Over the past few decades, heart surgery has undergone a remarkable transformation, evolving from highly invasive procedures that required large incisions through the breastbone and prolonged recovery periods into increasingly refined and patient-friendly approaches that prioritize precision, reduced trauma, and faster healing. And at the center of this transformation lies the rapid advancement of minimally invasive heart surgery techniques, which are redefining how surgeons treat complex cardiac conditions while significantly improving patient outcomes and overall experience. And to fully appreciate the impact of these innovations, it is important to understand that traditional open heart surgery typically involves a sternotomy, where the chest is open to provide direct access to the heart, allowing surgeons to perform procedures such as coronary artery bypass, grafting, valve repair or replacement, and structural corrections with full visibility and control, but at the cost of increased surgical trauma, longer hospital stays, higher risk of infection, and extended recovery times, often lasting several weeks to months, whereas minimally invasive approaches aim to achieve the same surgical objectives through much smaller incisions, sometimes only a few centimeters in length, without fully opening the chest, which reduces physical stress on the body and allows patients to recover more quickly and comfortably. And one of the most significant advancements in this field is the use of small thoracic incisions or keyhole approaches, where specialized instruments and high-definition cameras are inserted through tiny openings between the ribs, enabling surgeons to perform complex procedures with remarkable precision while preserving the integrity of the sternum and reducing postoperative pain. And another major breakthrough is the integration of robotic-assisted surgical systems, which provide surgeons with enhanced dexterity, three-dimensional visualization, and the ability to perform delicate movements that may be difficult to achieve with a human hand alone. And in robotic heart surgery, the surgeon controls robotic arms from a console, translating hand movements into precise actions inside the patient's chest, allowing for highly accurate procedures such as mitral valve repair, coronary artery bypass, grafting, and atrial septal defect closure, while minimizing tissue damage and improving surgical outcomes. And in addition to these surgical techniques, transcatheter procedures have revolutionized the treatment of certain heart conditions by eliminating the need for traditional surgery altogether in selected patients. And one of the most well-known examples is transcatheter aortic valve replacement, commonly referred to as TVR, where a new valve is delivered to the heart through a catheter inserted via the femoral artery in the groin or another access point, allowing patients who may not be candidates for open surgery due to age or medical complexity to receive life-saving treatment with significantly reduced risk and recovery time. And similarly, transcatheter mitral valve repair techniques such as edge-to-edge repair systems have provided minimally invasive options for patients with mitral regurgitation, offering symptom relief and improved quality of life without the need for open heart surgery. And these catheter-based approaches represent a paradigm shift in cardiac care, moving from traditional surgical interventions toward less invasive yet equally effective solutions tailored to individual patient needs. And the benefits of minimally invasive heart surgery extend beyond smaller scars and improved cosmetic outcomes, as they include reduced blood loss, lower infection rates, shorter intensive care and hospital stays, faster return to daily activities, and improved overall patient satisfaction, and for many patients the ability to resume normal life within a few weeks rather than several months can have a profound impact on both physical and emotional recovery. However, it is equally important to recognize that not every patient or condition is suitable for minimally invasive techniques, and careful patient selection remains a critical component of successful outcomes, as factors such as the severity and complexity of the heart disease, the presence of multiple blockages, prior surgeries, anatomical considerations, and overall health status must be thoroughly evaluated by an experienced cardiac surgical team to determine the most appropriate approach. And while minimally invasive techniques continue to expand their scope, ongoing advancements in imaging technology, including high-resolution echocardiography, computed tomography, and intraoperative imaging guidance, are further enhancing surgical planning and execution, allowing surgeons to visualize cardiac structures in extraordinary detail and perform procedures with increased accuracy and safety. And as technology continues to evolve, innovations such as hybrid procedures, Combining surgical and catheter-based techniques are becoming more common, providing customized solutions for complex cases that require a combination of approaches, and the future of minimally invasive heart surgery is also being shaped by developments in artificial intelligence, enhanced surgical navigation systems, and improved biomaterials, which may further reduce complications and improve long-term durability of repairs and replacements. And alongside these technological advancements, the role of multidisciplinary heart teams, including cardiologists, surgeons, anesthesiologists, imaging specialists, and rehabilitation experts, has become increasingly important in ensuring that each patient receives comprehensive personalized care from diagnosis through recovery. And for patients considering heart surgery, understanding these minimally invasive options can be empowering, as it opens the door to discussions about treatment choices, recovery expectations, and long-term outcomes, and encourages active participation in decision-making rather than passive acceptance of traditional methods. And while the promise of minimally invasive surgery is significant, it is essential for patients to approach these options with realistic expectations, recognizing that the primary goal remains the effective treatment of heart disease and the restoration of healthy cardiac function rather than the avoidance of surgery itself. And ultimately, the evolution of minimally invasive heart surgery reflects a broader shift in medicine toward precision, patient-centered care, where advanced technology and surgical expertise come together to deliver safer, more efficient, and less disruptive treatment options. And as these techniques continue to advance, they hold the potential to further transform the landscape of cardiac care, offering hope, improved quality of life, and better long-term outcomes for patients around the world who require life-saving heart interventions.